Hi viewers, do you know that the prevalence of anemia in India, especially in young women, is around 50 to 60%? Hi, my name is Dr. Amrita Ramaswami and I work as a consultant hematologist in Max Super Speciality Hospital, Shalimar Bagh. Today we shall talk about what anemia is, whether it is a disease itself or whether it is a symptom of another disease, what are the causes of anemia and how as a society we can prevent anemia from being a major public health problem. Now, anemia is by definition a drop in the hemoglobin. Our blood contains a substance called hemoglobin, which is responsible for carrying oxygen to various parts of the body. And when the hemoglobin is low, the patient is said to be anemic. As per WHO, the definition of anemia is less than 12 gram per deciliter in women and less than 13 grams per deciliter in men. So anybody who has a hemoglobin of less than 12 if it is a woman, or if less than 13 if it is a male, they are said to be anemic. And what are the problems of anemia? What happens when somebody has a low hemoglobin? They feel tired, they feel fatigued, they can have body pains, they can have headache, and they cannot carry about daily activities. They go through their day feeling extremely fatigued. Apart from that, anemia can also cause low birth weight if the mother is suffering from anemia. So anemia contributes to a whole lot of public health problems and health issues in both males and in women. Anemia is not a disease in itself, it is a symptom of another disease. Coming to the causes of anemia, the most important cause of anemia is nutritional anemia. That is when somebody does not have adequate iron or vitamins in their body to produce blood. And nutritional anemia is because of poor oral intake, poor diet intake. We do not take a diet which is rich in iron and which is rich in vitamins for blood production, and hence patients who have a poor diet, they have anemia, they have a low hemoglobin. Apart from that, other causes of anemia could be inherited diseases like sickle cell anemia and thalassemia, and we also have certain bone marrow problems like aplastic anemia which can present with a low hemoglobin. Nutritional anemia is something which I would like to talk about, which is something that is very easily corrected. So iron deficiency anemia is prevalent, is very rampant in India, and it is seen in young women especially. In women it is more common because women have menstrual blood loss. They lose blood every month, and because their diet intake also tends to be poor, they end up being anemic. A simple way to correct this is to approach a gynecologist if you have heavy menstrual bleeding and to take iron supplements. Anemia is an easily correctable issue, especially if it is related to iron deficiency, B12 or folate deficiency. If anemia is caused by any of the other diseases like sickle cell anemia or a bone marrow disease, then you should be probably consulting a hematologist, because the solution to anemia caused by bone marrow diseases is not very simple as supplementing iron and B12. Nutritional anemia is something that is easily corrected, and if you have a low hemoglobin, you should consult a hematologist to find out why you are having a low hemoglobin. Thank you.